So I would like to to have the opportunity to be able to come and talk about the world of CCAC and how we might support patients through their journey with cancer care, and how do we really look at it as living well with cancer and looking at it as a chronic disease. I've divided my presentation, the 10 minutes, into a couple of areas. The first is just doing a bit of an overview of CCAC and some of the changes that we've been undergoing over the last several years, and then really doing more of a focus around that intervention that we can provide during the client journey. So for any of you that don't know, we're one of 14 CCACs across the province of Ontario. Our boundaries happen to replicate the boundaries of the LHIN, so we cover from Tobermory down to Lake Erie in the south. We have 7 offices across the southwest. As well, we have care coordinators and case managers located in every acute care hospital across the southwest. On average, our CCAC provides about 2 million visits per year to the residents of Southwest, and that would include our professional services as well as our non-regulated health professionals and our PSWs that support clients in the home. And every month we're able to connect clients to discharge about 2,000 clients from the hospital to home. We transition about 50 to 100 clients from acute care and the home to long-term care facilities. And we make over 6,000 referrals to other community support agencies, because as you all know, it isn't about any one single provider being able to provide support to patients in the community. It's about all of us wrapping around to be able to support them at home. And we, on average, about 2,500 clients a month, and we receive 7,500 to 8,000 referrals every month for our services in the home. Our clients, we have more than 60,000 a year. We actually support clients from cradle to grave, so through the whole care journey. Our mission is outstanding care, every person, every day, fairly lofty vision that we hope to be able to attain. We believe in a client-driven care approach to our clients and our partners, which means working in partnership and in collaboration with the partners, keeping our families and the patients at the center of care, building on those trusting relationships with folks, understanding one another, working on people's strengths, and it really is an empowerment approach. Some of the services that we do provide are care coordination, and you'll hear people start to talk about care coordinators versus case managers. We're just in the province across Ontario of transitioning from the name of case manager to care coordinator, which actually describes the function much better, and I think it if I were a patient receiving support, I would much rather not be called a case and not to feel that I was managed. So I think care coordination is much more reflective. We provide nursing in the home as well. We're very fortunate in the Southwest. We have 11 nurse practitioners that cover across the Southwest. They're currently focused on supporting clients, more complex clients as they transition out of the hospital to the home. As well, we have an excellent nurse practitioner that many of you would know, Grace Bradish, that supports clients in the South. Grace has been, I would say, one of the best found secrets for the community to be able to be that linkage between the regional cancer program, linking out with primary care and providing that support. We also will be recruiting, you'll see, for 5 new nurse practitioners for palliative care. We just received funding for that. Those will be nurse practitioners, again, that extend across the Southwest. Of course, we provide personal support, all of our therapies, medical supplies, social work, nutrition. And also we do that linking and information and referral for our clients. The couple of other areas we've recently been involved with is mental health and addictions in the school system, as well as some rapid response nurses. So care coordination, what can that provide for patients and families? It really is doing that initial assessment, and people often think, oh, they come to CCAC and it's because they need nursing in the home or they need personal support, but often it is just connecting them up with others in the system, connecting them up with and making that linkage with primary care. So it's helping and supporting that system navigation. Not us taking on all of the system navigation, but perhaps we're linking with the navigators that many of our primary care teams have. Linking with primary care, this is a critical role for us. We currently have care coordinators aligned with 109 primary care physicians across the Southwest. This has been a very intentional linkage to work with those teams for them to be able to connect with the care coordinator to review clients that perhaps are needing admission and support by CCAC. It's been a very successful program, and our goal is to be able to link with the rest of the 500 physicians across the Southwest. It ensures that connection with clients. We want to be able to share with our primary care team what is happening in the home, because it's very frustrating. A patient goes in and has a conversation with their primary care physician, and if we're not sharing and being able to give that primary care team a heads up of what's actually happening in the home, that isn't a very supportive system. So that's what we're trying to work differently. We're also looking at the electronic sharing of medication profiles and discharge summaries from the hospitals. So we would not only be able to share those with our providers out in the community, but also with our primary care partners. Home First. Home First has been getting a fair bit of attention, media attention across the Southwest. Home First really came in to facilitate decreasing the number of ALC clients in the acute care hospitals. Really, it is not a program, it's a philosophical approach to patients as they come into hospital. So instead of somebody looking at a frail elderly or perhaps a palliative care patient and saying, you know, time's here, you need to stay in hospital or you need to go to long-term care, don't utter those words. The right conversation should be, how might we get you back home with the right supports? So it's a real philosophical shift, not only for our staff, but for our acute care partners. We've had probably one of the most successful programs with Home First across the province. In the month of September, in the 5 hospitals that are participating, there were only 3 newly designated ALC clients for long-term care. And when we reflect and look back, that number would have been more in the neighborhood of 50. So it's been a very successful program. Home First, we've supported many palliative clients on Home First as well. And it really is just looking at them differently and getting them back home. So the client journey. Often the initial connection with CCAC is at the surgical or diagnostic confirmation of their diagnosis, and this referral is often made up front by the medical care team to CCAC, but what I want to stress is anyone can make a referral to CCAC. You know, a family member can make it on behalf of their parent or their spouse, as long as they have consent, but it doesn't have to be a medically generated referral. But often the initial contact is around treatment supports. The client journey, the client doesn't always come on our program with supports and then stay on forever, but there may be varied times during their cancer care journey where they do need supports from us. So they may come on initially for some treatment support, but we also, early on, we want to encourage those self-management and empower them to live their life as in the new normal, as we heard earlier. But we always want to ensure patients and their families, how can they reconnect with us as their journey goes on. We have always done a significant amount of support around the end-of-life phase or the palliative part of the journey, and that would be one area that I believe we've actually increased our level supports by having the availability of a nurse practitioner available and that linkage up to primary care. And also caregiver relief, because we know when people during the end-of-life journey decide that the right place to be is at home, that's a huge burden on the family and the caregiver. So how can we give them some respite to be able to remain at home? We believe that it's critical for us to work as part of a care team and to be able to support patients to remain at home or wherever they need to transition at their end-of-life care. The patient and family are the orchestra leader. The rest of us are there really to be able to support them as a supporting cast. Some other initiatives, and I was very interested when Gail was talking about the new LRCP website, and I'm hoping there will be a link on that to healthline.ca. This is a website that when we do client satisfaction surveys or have conversations with families, many of them use Healthline as a connection in to find a variety of healthcare opportunities or what is really happening out there. So this would be a great place to link in on the LRCP website. It's easy, some of you may not think so, but to get a case manager or care coordinator, we are available 8 to 8, 7 days a week for assessment and being able to connect people to care. All of our service providers, our nurse practitioners, are available 24/7 in the community. And we have, as I say, the CCAC care coordinators on site in the hospitals. Depending on the size of the hospital, they are there 7 days a week. These are just some connections that will be attached and available for folks about the websites that you might want to go in and take a look at. And I noticed there was a bit of an error here on my grammar. I would just want to thank everybody for allowing us to be a part of the care system that supports patients and families through their care journey. And I think it's opportunities like this where we can all get together, that we can really understand what part each of us play to be able to collaborate and wrap around clients and families to be supported at home. Thank you.